Imagine you could step inside the minds of Canada's healthcare leaders, glimpse their greatest fears, strongest drivers, and what makes them tick. Welcome to Healthcare Changemakers, a podcast where we talk to leaders about the joys and challenges of driving change and working with partners to create the safest healthcare system.
Welcome to Healthcare Changemakers, a podcast produced by HIROC. I'm Ellen Gardner with Michelle Holden and Philip D'Souza. Today's guest has a special place in the HIROC archives. Sarah Downey was our first guest on Healthcare Changemakers when we turned on the mic in 2018. The years that followed that fun interview have been busy for Sarah. For 7.5 years, she was the CEO of Michael Garron Hospital, where she shepherded the hospital through a major redevelopment project that included the newly opened Thomson Centre. 6 months ago, Sarah made the decision to move into the president and CEO position at the Centre for Addiction and Mental Health, better known as CAMH. Leaving Michael Garron and the East York community was tough, but the pull to the mission of CAMH was stronger. Sarah believes mental health is the most important issue of our lifetime. It's a new place and a new culture to learn about, but Sarah always comes back to the importance of being human and being vulnerable in a leadership role. Where talking to people in the coffee lineup is one of the most important things you can do as a CEO. Welcome to Healthcare Changemakers, Sarah. It is so great to have you back. Philip and I really remember when we first came to interview you. It was 5 years ago at Michael Garron, and we just had such a lot of fun. So it's really wonderful to have you back.
Well, thank you for coming back. I appreciate it.
We know it's been a busy few months for you. You've transitioned away from being CEO of Michael Garron Hospital to CEO of the Centre for Addiction and Mental Health, better known as CAMH. So first off, maybe tell us how things are going.
Things are going well. I'm in the end so privileged to work in healthcare. As tough as it is, it's a time of great excitement and challenge. And in spite of 30 years in healthcare, I still feel inspired by the work of healthcare. And I feel privileged to have been part of a great organization at Michael Garron. And I'm thrilled to be reintroduced to an organization I knew 7 or 8 years ago at CAMH. It's been a process, and some of those transitions are not easy. It's not easy to say goodbye. It takes a lot of energy to say hello. But I feel like I'm kind of through that process and fully engaged now in CAMH.
Tell us a little bit about that goodbye. I'm sure it was tough because you'd been at Michael Garron for 7.5 years and you accomplished so much during that time. You always talked about how it was your neighborhood. So tell us what it's been like and yes, the transition to a new organization.
Yeah, it's you forget, I guess, until you have to do those transitions, just how emotional they are. And they're emotional because I formed genuine connections with a cause and, more importantly, the people behind that cause at Michael Garron that really meant so much to me. And so it just takes a whole lot of energy to respectfully say goodbye to people and explain your decision, which is sometimes not easy, and to find energy and place it in your heart for a whole pile of new people that you're going to, get to work with and a different cause you're going to embrace. So these things take time, and it's important, through tradition and through respect and connection to do those things respectfully. And I hope that I've been able to do that between the two organizations.
CAMH is, not an unfamiliar place to you. So you served as Executive VP of Clinical Programs for 3 years between 2011 and 2015. Nice that you get to see some familiar faces and meet new people. Is anything standing out for you that's different now from when you worked there previously?
As you know, healthcare organizations change so much over time, and this one is no exception. In the time I was away, it opened 2 fantastic new buildings that actually front onto Queen Street. A major part of this hospital's vision has been to create an urban village on West Queen West. And I was part of the visioning of the latest round of redevelopment when I was here last time. And I got to miss all the hard stuff, which is building the buildings and paying for them. And I get the immense pleasure of seeing the occupants in their new spaces. The fundraising at CAMH has been extraordinary, and we launched a fundraising campaign last week of $500 million, of which over $400 million has already been raised. That is immensely different. There's a lot of advances in research and expansion of the research mandate at CAMH. That's been a thrill to get to know. And, like many healthcare organizations, there's a lot of new talent out there. And I've met some young leaders and new leaders who are truly inspirational here. And that's been a wonderful part of, getting reacquainted with the place, is to figure out what is different and find out all the many things that are indeed better than when I was here before.
Can you talk a little bit, Sarah, about the new buildings? What makes them unique? What's special about them?
This campus is extraordinary. And the amazing benefit for CAMH, actually, which is a merger of 4 organizations 25 years ago, has been to be able to build the organization, physically build it and emotionally build it and, programmatically build it, but to physically build CAMH that is different than the elements that came into this merger. And so this is the third phase of the 4 phases of redevelopment. And it was the few unique things. One is a consolidation of all the clinical programs onto the Queen Street site. So it was the 2 new buildings are about 225 beds. Of some of the most acute units that we have at CAMH, it's a new emergency department. And every room, which is the standard for mental health, is a private room with its own washroom. And that is so different than what many of the buildings that were built, many years before were like for people with mental illness. So they're respectful spaces focused on recovery and healing and dignified care for people, many of whom are acutely psychotic and or spending a long period of time in our care as they find their path to recovery. So they're bright, they're airy, they have outdoor spaces, there are gardens around that help in their recovery. And so the clinical facilities are superb. In addition to which is a brand new education space for the immense education mandate that exists here, and a new auditorium. And some of the unique features of construction here is the artwork that forms part of the wayfinding and the symbolism of what's important at CAMH. So for anybody out there who wants a tour, please do get in touch with me. This is a remarkable example of respectful and recovery-focused and innovative construction. And it's thrilling to see these latest 2 buildings and to think ahead to the next phase of construction here over the next 5 years that, in fact, will be the biggest phase of redevelopment in CAMH's history.
CAMH has such a reputation. It's been just part of the Toronto landscape for so long. And I just remember all those years seeing the facility on Queen Street. And I think what's changed is that our whole approach to mental health has really evolved. And if you think about it, it's a completely different philosophy around mental health care and treatment. Do you remember those years?
I do. And I've read the history of some of those years, right? This used to be, there has been a mental health facility on this location since 1850, when it was called the Provincial Lunatic Asylum. And, you fast forward to 2023 and you look at the urban village and the respectful spaces and the park areas. I mean, people used to cross to the other side of Queen Street to avoid walking in front of the old asylum and the walls that were built around it to protect the patients from the people outside and to protect the people outside from the patients inside, to a place where that is now a historic wall. Parts of it are taken down, but part of it remain. And it's actually a beautiful wall that reminds us of the past that once was, how we treated people who lived with mental illnesses. And, we've come such a long way, right? Mental health is health. I think we all know and understand this. It's not just a 1 in 5 will get mental illness in their lifetime. It's in everybody's family. We know that. And it's in all your social circles and it's in all your employees. It's everywhere. And we need a different kind of movement, I think, in mental health in order to make substantial changes in the diagnosis of these illnesses, in the treatment of these illnesses, the acceptance of people who live with it. And that's one of the reasons I came back, was to try to build a movement of accepting and designing much better programs and systems for people who live with these real illnesses and real struggles in life.
I read recently an article about a person who'd had long-term depression, and just it really was, despite everything that was tried, nothing really worked. And it just shows you how far we have to go in understanding and treating an illness like depression.
Some of it, in fairness, is the application of evidence-based treatments in the area of depression. And, I'll give you an example. We've developed a brain stimulation protocol that's not yet funded, but hopefully will soon be, to treat what's called treatment-resistant or refractory depression. So there are treatments and tools available on some of these fronts that actually need to be standardized and made available to people consistently. Because I don't think we're always getting the right treatments or therapies to people. Inappropriate use sometimes of medication. It's the understanding that the talk therapies are also really important and required to help manage some of these chronic mental illnesses. Treatments for families, interventions for families are helpful. And the incredible impact on such social determinants of health for many people who live with mental illnesses, right? People who live on the streets, people who have precarious housing, people who can't get employed, people who don't have family with them. It takes a lot of different aspects to treat this. I used to work in the cancer system, and my 10 years in the cancer system were all about increasing standardization and precision of treatment for cancer and the precision of diagnosis as well. And I sure look forward to the day that we're talking about the same things in mental health and addictions.
You mentioned earlier how coming to CAMH was a big transition for you, and that, yes, you were drawn to the fact of it being an accelerating movement. So I want to ask you, what did attract you to this new position?
I believe that mental health is the most important health issue of my lifetime. I think it's a thing we're still trying to figure out how to get it right. It's the most complex of systems, and it's a part of our bodies that we understand the least. And I think about all the accelerations and things we were able to do by working together in this pandemic, and I'd love to see, right, health systems and research and science, and governments and policymakers and funders and fundraisers galvanize support to make a huge impact now on mental health and addictions. And so that's why I came back. It's the potential of all this, and that it is, in my opinion, the most important health issue of our lifetime.
Have you seen a mental health crisis up close? Is it something that's touched you personally? I know it touches a lot of us, but has it touched you personally?
Of course it has, right? I have, it's everywhere. It's in my colleagues, it's in my family, it's among my friends. And, I don't know that people are always as open and upfront about it as they might be if they'd broken a leg. But there are a lot of people who talk about their struggles in a different way. I had forgotten, actually, until I'd come back, that how many people call to get advice on how to navigate this system. And I must get 2 or 3 phone calls a week from people just trying to figure out what to do with their teenager who won't get to school, or their elderly mother who can't remember things anymore and probably shouldn't be driving, or, a sister who really is drinking too much, and how do they get them help? And so this is everywhere.
It's no surprise to anyone that there's been a widespread increase in mental health challenges facing teenagers. And while rates of smoking and even drinking have gone down, rates of depression, anxiety, self-harm, and even suicide have risen sharply. In fact, a report from the CDC found that 57% of teenage girls felt persistently sad or hopeless in 2021. That's the highest rate in a decade and almost twice what was reported by teenage boys. So part of the problem in the States is there aren't enough mental health treatment options available for adolescents. Just from what you've seen, Sarah, do we have that sort of similar experience here in Canada, or, are treatment options a big problem?
We have exactly the same problems. I don't know that we effectively capture access to care challenges and struggles the way we should, and I think we should, but 100%. It's amazing how many eating disorders programs were opened during this pandemic. I opened one at Michael Garron. There's a lot of pressure on university students. CAMH has a partnership with the University of Toronto's mental health program to identify U of T students in our emergency department and hook them back up to services in the U of T, because universities need to be experts, right, in supporting some of their students who, it's a prime age for mental health problems to occur. Who's more important for us to invest in than our young people? They are our future, and we need them to be healthier and more resilient to create the kind and compassionate world, fix a number of the world's problems that we face today. And so, I look forward to working with all kinds of partners and creating that movement and getting better, faster service to people.
Part of the problem, as you say, is related to a shortage of professionals and lack of options for treatment. So I'm sure at CAMH you're experiencing the shortage of people. What are some of your ideas on bigger solutions to the problems we're seeing around keeping staff engaged and attracting new people?
There is no easy solution. And so what I talk about inside my organization is the importance of retention, because, of course, to have to replace somebody who has years of experience takes a long time. And so whenever I talk to staff, I try to make sure that, understand what it is that makes them choose to come back for another year and avoid dipping into their pension plans. And that's a lot about wellness. I would encourage everybody to look at the amount of even psychological benefits they have as part of their benefit plans. What are some of the tools in place to help people stay longer? How do we treat older or more experienced employees in our organizations to make them continue to want to stay in these professions? What educational opportunities do we pay for to get people to advance their education, have interesting and diverse careers in our organizations? So, I think retention is a huge issue. The other, of course, is recruitment and bringing new recruits up to speed in what are very complicated and complex professions. And, I'm amazed when I go and I talk to staff on units here, and I'm sure the same was true at Michael Garron, is how many of them have been in practice for 3 to 5 years and sometimes less, right? There's a lot of junior staff out there. And so education supports and after-hour supports are really important to factor in, because it takes, a while to be experts in their chosen professions. This is going to take years, right? And it's going to take the promotion of health professions. Neither of my teenagers talk at all about wanting careers in the health professions. I'm sure they're not unusual, but, it's going to take a lot of work to value, again, these professions and to create meaningful careers for people that can stay 20, 30 years in these fields and advance and progress to make them want to stay in it, even as long as I have, which is now 30 years.
Then I really wonder, Sarah, just based on your years in the profession and years as a healthcare leader, what advice would you give other healthcare leaders about being a clear communicator and just connecting with people, being human in your communications? Do you have any key pieces of advice that you would give?
Yeah, I think to be human, to connect with people, to show genuine interest in people, to be vulnerable, to remember their names, to listen to them honestly, to regularly connect with people, to use a bit of humor is important. They want to know that their leader is real. As I was leaving Michael Garron, there was a woman who worked in the chemotherapy clinic, and she was a housekeeper. And she came up to me on my going away party, which she'd taken the day off to attend, which was beyond lovely. She came up to me and she hugged me and she said, you're the only CEO that I've ever been able to touch. And I thought, how can, this is somebody who's older than me, who's probably worked, in an organization run by several CEOs in the past. But it's that idea of being human, right? She's a mother, I'm a mother. She's a working mom, I'm a working mom. There's so many areas of commonality that we share with people, right? We do different jobs, but her job was as important as mine, maybe more important in that organization. And it's all those human, relatable conversations you have with people all the time that to me make a difference. They've made my job entirely more fulfilling. And I think that they feel they work in an organization that cares for people when their CEO knows their name or knows their story or can have a casual conversation. I think that's how you stay in touch with the tone of an organization. And for sure, CEOs and director manager level people, anybody in management gets so busy in their jobs. But I often thought the most important part of my job at Michael Garron, and the same is true here, is the time you spend in a coffee lineup, the time you spend, walking to a parking lot or in an elevator lobby. So just take that chance to talk and connect with people and hear how things are going. And it's amazing, the stories you'll learn and the people that you will connect with that you'll keep in your heart forever. And I'm fortunate to have a heart full of incredible people and stories that have inspired me for a long time.
You've always made your own mental health a priority. Just seeing how you spend time with family, you take vacations, you've said you make a point of leaving work at work. Has anything changed for you in the last couple of years?
I would say that the tough thing about becoming a CEO is you can never actually leave your responsibility for an organization. And as I've often said to my family when we go away on vacation, I'd say, if something terrible happens at home, I do have to go back, right? If something happens at the hospital, no matter where we are, I will have to return because you can never sign out that responsibility as a CEO. You can in other levels of the organization, and I gladly gave my responsibilities to my bosses at different times as I traveled the world and did exciting things. But, you have to create spaces between your worlds in order to be able to survive. And, I feel I've made career choices that have kept me close to my family. Working at Michael Garron, when I went there, my kids were in grade 1 and grade 3, and they were at school 2 blocks down the street. And that was one of the big factors, was to be close to home in a community hospital that mattered. I now feel a lot of passion for mental health care because I have adolescents. And this hospital is, like 10 kilometers maybe from my house. So it is a little further, and that takes, 45 minutes to get to in Toronto with the traffic. But I feel passion for that, and that is because of the passion and energy I feel for this generation of people who need access to care. And so it's linking your worlds and keeping them separate at different times. And as my kids and husband would say about me, is that I get up and I run to work. As much as I love them, I feel passion and energy for what I do. And I think that's good for them to see. You really do need to take a break. And that has been hard in this pandemic. The vacation banks and organizations have grown tremendously because the definition of vacation changed. I used to think to take a vacation, I've got to get on a plane and go somewhere. We've all had to redefine what vacation means, but it's been even more important in the last 3 years to find a break in a space. But what an opportunity to learn. I've, gotten to know parts of Ontario, taken local vacations that I hadn't contemplated before.
It's Philip here, Sarah, and we could probably talk to you all day, but we know you have to go soon. But so I'll ask you only a couple of questions. But
sure.
Ellen touched upon, just how many in the healthcare sector admire you because of your true, authentic self. And we know that, I'm sure that came to you through something. I don't know if it's through family. I can tell how much you care and love your family. So I don't know, perhaps it's a lesson learned from your parents or another loved one. But can you share where did that come from?
Yeah.
Tell us that story.
It comes from both my parents, but particularly my dad. So my parents are Newfoundlanders, though they left Newfoundland in their 20s, but came from nothing, came from outports in Newfoundland, were able to go to university because of scholarships. Granted by Joey Smallwood, the then Premier of Newfoundland, to get kids out of outports to go to university. And I had a terrific dad. He passed away almost a year ago. who from, growing up from a generation of fisher people, which is important in noble work, which is what got, them from the England over to Newfoundland in the first place, so generations in the fisheries. My dad would, through education, get a PhD in English literature, become a university president. He was president of 3 Canadian universities, an officer of the Order of Canada, who was always incredibly humble and understated in everything he did. And so I guess he was a great influence on me, and I miss him dearly, of course, now that he's gone. But I hold his lessons in my heart every day and try to act in a way that would always do him proud.
I love that story, and it's true. I always I was on a call the other day. We were talking to somebody who. It's funny you mentioned in Newfoundland. There's this doctor named Dr. Hilda Tremblett, and there's a wellness center named after her. So I was talking to somebody to ask if we could find her, if we wanted to interview her. Yeah. And then the person answered the phone. She's like, you know what? We need to tell people while they're alive, and thankfully Hilda's obviously still around, that we want to pay homage and pay respect to all the stuff they're teaching us and everything they've given us. And so she said, that's why we named the building after her now. She's like, why are we going to wait for somebody, and so, and then I said to myself, I was telling my team afterwards, you know what, we should tell people every day in the moment, who are helping us change our lives. And so I can tell just from hearing how you talk about your children and your family that how much they mean to you. And I can just tell, I don't even know you. I don't come to your house for dinner or anything, but I can tell that you probably each tell each other that.
You act in a way that becomes your family's norm, right? Yes. And anything that would ever appear arrogant or conceited would be poorly seen. In fact, I remember when I was working at Princess Margaret, my father was working in Toronto at the time, him coming to see me in my beautiful office on the 16th floor of Princess Margaret in a venerable institution. I was a vice president at the time. And he was there at the end of the day, and the housekeeper came in to clean my office. And of course I knew her name. How would I not know her name? I'd see her every day when she came to clean. And when she came to clean, I said, hi, Betty, how are you today? And my father said, as we left, he says, I'm really proud that you know the name of the person who cleans your office. In fact, and at the time, he recently stepped down as president of the University of Waterloo, and her great pride was that she had 2 children at the University of Waterloo.
Beautiful story, Sarah. And I think so much of our lives always relates back to lessons we learned from our parents. So I'm really glad you shared that with us. So we're moving into the lightning round. So I want to start by asking you, if you were arranging a special dinner with 3 other people, who would you choose to invite and why?
For obvious reasons, I would invite my dad, who passed away last year, and I'd love to have a dinner again with my dad. I'd invite Julia Child to cook it and hear all her stories. And I'd invite Drake to sing and dance at it.
Sarah, what's your best tip for dual career couples?
So I'd say appreciate the tiny moments. I think sometimes I find that you try to put grand plans together, like every Thursday night we'll have a date night. And when that falls, apart because life gets busy, then you feel frustrated. But we try to appreciate, the moments as they exist. And so whether it's watching CBS Sunday morning at 9 a.m. on Sunday mornings, or starting and getting through a Netflix series, or whatever it is to find, don't look at the long run sometimes. Look at the small moments you're able to capture together and enjoy something and not worry too much about the big things.
Are you better at being a good party guest or a good party host?
I love to host a party. My husband calls me the French word amphitryon, which is like a party planner and organizer and hostess. And before the people have left, I tend to be organizing the next one. So I love to host a good party. Maybe that's a maritimer in me, and a good maritime kitchen party. But I love to host a party.
What would be one word or a couple of words of advice for someone just starting their career?
Be patient, get to know people, and keep learning.
So finish this sentence. If I wasn't in healthcare, I'd be working as a...
I'd love to be a diplomat. And I'm sure they're really hard jobs. So I fantasize about someday being the Canadian ambassador to France. So I don't know how you do it. And it's years and years of hard work, and it's clearly too late for me to do that. But that is my fantasy of living in the Canadian embassy in Paris and hosting nonstop parties.
You've picked a good country, so that's great. Thank you so much, Sarah, for coming back to talk to us again. It's been, as always, just a real pleasure, and we always enjoy speaking with you.
Well, thank you, and thank you to HIROC. I've loved listening to many of my esteemed colleagues and friends do this series, and thanks for stepping up and trying to make healthcare leaders seem human and approachable. So thanks for doing that. The sector learns a lot from this experience.
You have just been listening to our interview with Sarah Downey, President and CEO of CAMH, the Centre for Addiction and Mental Health. For more information about HIROC and to listen to past episodes of Healthcare Changemakers, go to our website, hiroc.com. Thank you for listening.
Thank you for listening. You can hear more episodes of Healthcare Changemakers on our website, hiroc.com, and on your favorite podcasting apps. If you like what you hear, please rate us or post a review. Healthcare Changemakers is recorded by HIROC's Communications and Marketing Team and produced by Podfly Productions. Follow us on Twitter at HIROC Group or email us at communications@hiroc.com. We'd love to hear from you.